We are studying the molecular basis of the neurological alterations in essentially minimal hepatic encephalopathy, and we will focus today on the mechanisms of some types of cognitive dysfunction. And we believe that most neurological alterations in minimal hepatic encephalopathy are due to alterations in neurotransmission. For our studies on the mechanisms, we are using animal models of minimal hepatic encephalopathy, mainly rats with portacabal shunt. And to assess the role of hyperammonemia, we are using a model of chronic hyperammonemia without liver failure that we get by feeding rats an ammonium-containing diet. And with these models, we study different types of learning and memory, which are moderated by different mechanisms involving different brain areas. These are some of these tests that we perform, testing the Y maze, Morris-Water maze, radial maze, and today we will focus mainly on the Y maze. In this test, the walls of the maze can be white or black. When they are white, food is put on the right. When they are black, on the left. And rats must learn what is the food depending on the color of the wall. We put the rat here, and depending on the color of the wall, she must learn what is the food. They perform the test 10 times per day, and we assume that they have learned when they perform correctly the 10 tests on the same day. We are using this test for many years, and we have found that the ability to learn this test is modulated by the function of the glutamate nitric oxide cyclic GMP pathway. Activation of NMDA receptors increases calcium in the postsynaptic neuron. Calcium binds to calmodulin and activates nitric oxide synthase, increasing nitric oxide, which activates guanylate cyclase, increasing cyclic GMP. And part of this cyclic GMP is released to the extracellular fluid, and this allows us to measure the function of this pathway in vivo by using microdialysis in freely moving rats. We set a microdialysis proof in the cerebellum of the animal, and we take continuously samples of the extracellular fluid, and we can measure cyclic GMP. We can also add NMDA through the same proof, which activates the pathway and increases cyclic GMP. And the increase in cyclic GMP induced by NMDA is a good measure of the function of this pathway in brain in vivo in freely moving rats. We have studied this system in many different experimental conditions, and we have found that situations which impair the function of the pathway impair the ability to learn this Y maze task. And this occurs, for example, with aging, by developmental exposure to some contaminants such as PCBs, methylmercury, and also occurs in hyperammonemia or hepatic encephalopathy. This is, for example, what happens with the function of the pathway with age. In 3-month-old rats, this is the function of the pathway. This is the basal level of cyclic GMP. When we add an NMDA, this activates the pathway and increases cyclic GMP. If we use rats which are 7 months old, the function of the pathway is strongly reduced, and the increase in cyclic GMP is much lower than at 3 months. And these rats at 7 months need much more time, much more tests to learn the task than rats which are younger. Therefore, aging impairs the function of the pathway and the ability to learn this task. But there are also situations which increases the function of this pathway, and they increase also the ability to learn the task. And this occurs, for example, in rats with developmental exposure to PBDE99. This is the function of the pathway in normal rats. This is the basal level of cyclic GMP. We add an NMDA, and this increases cyclic GMP to here in normal rats. But in rats exposed to PBDE, the increase is larger. The function of the pathway is better because this treatment increases the amount of calmodulin, and these rats need less trials than control to learn the task. Therefore, improvement of the function of the pathway reduces the time needed to learn the task. And we have done these studies in many different situations, and there is a good correlation between the function of the pathway and the ability to learn the task. When higher is the increase in cyclic GMP induced by NMDA, lower is the number of trials that the rat needs to learn the task. Therefore, the ability to learn this task is modulated by this pathway. We tested what happens with this pathway in hyperammoid rats or rats with portacabal shunt. And as you can see here, this is there is an impairment of the function. This is the response in normal rats, and in portacabal-centered rats, the function of the pathway is reduced, and also in hyperammonemic rats, indicating that some step of this pathway is impaired in brain in vivo in hyperammonemia or portacabal-centered rats. Moreover, these rats need more trials than control to learn this task, indicating that they have impaired the ability to learn the task. Therefore, hyperammonemia impairs the function of the pathway and the ability to learn this task. Now the question is the reduced formation of cyclic GMP responsible for the impairment of the cognitive function? If this is the case, we should be able to restore the ability to learn by restoring the levels of cyclic GMP. And we could do this, for example, by inhibiting degradation of cyclic GMP with sildenafil, which inhibits phosphodiesterase 5. This enhances the levels of cyclic GMP and should improve cognitive function. We tested whether sildenafil restores the function of the pathway and the ability to learn in rats with portacabal-sant. As you can see here, rats with portacabal-sant have lower levels of cyclic GMP in cerebellum, and treatment with sildenafil restores cyclic GMP levels to normal levels. And this also restores the ability to learn. Rats with portacabal-sant need more trials than control to learn, and if we treat them with sildenafil, this restores the ability to learn. Therefore, restoring the levels of cyclic GMP restores the function of the pathway. Then, this data show that hyperammonemia impairs the function of the pathway, reduces cyclic GMP, and this is responsible for impairment of this type of cognitive function. It is clear from the studies in the last years from several groups, including our group, the group of Jalan and other groups, that hyperammonemia and inflammation act synergistically to impair cognitive function in patients with minimal hepatic encephalopathy. Then we studied the possible role of neuroinflammation in this situation. We studied whether rats with portacabal-sant show neuroinflammation, and we found that in the cerebral cortex of rats with portacabal-sant there is an increase in inflammatory